My name is Francisco Guerrero, and today I'll be performing the head of the table thumb spinous push, left rotation restriction, and that is student 3. So my contact point is the right thumb, the tip of the thumb, and the segmental contact point would be the inferior lateral aspect of T1 spinous process. And then my stabilization hand is my left hand, and stabilization segmental contact point is the mastoids bilaterally, using my index and my thumb. And then line of drive. My forearm is going to be parallel to the ground and segmental, and perpendicular to the segmental contact point, lateral medial. Now I'll be doing the seated index pillar push on C5 with the left rotation restriction. My contact point will be my right lateral index finger, and my contact segmental point is going to be the right articular pillar, and the stabilization contact point is my left calcaneal with the fingers pointing down, and the stabilization segmental contact point is the left inferior mastoid process with the left inferior cheek. So continuing back. And then line of drive would be lateral medial, P to A, counterclockwise. Alright, so now I'll be doing the prone index pillar ipsilateral push on C5, left rotation restriction. So my contact point will be my lateral aspect of the index finger of the superior hand, my right hand. The segmental contact point will be the posterior aspect of the right articular pillar. The stabilization hand would be the thenar of the inferior hand and my left hand, and this tractioning up, and the segmental stabilization point is the left mastoid and the posterior inferior occipital rim. Line of correction is P to A, I to S, in line with the plane of the disc with a forearm parallel to the ground. So now I'll be doing the seated hypothenar mastoid occipital lift, and it's going to be a right rotation restriction. The contact point will be my hypothenar of the left hand, and his segmental contact point will be the left mastoid and inferior occiput. The stabilization point will be the hypothenar of the right hand, reinforcing the contact hand, and the segmental stabilization point would be the dorsum of the left hand. And the line of drive will be P to A, I to S, lateral medial, left to right with a slight scooping motion. So can you lean back, and can you turn your head to the right? I feel like I need it. Alright, so now I'm going to be doing the supine anterior thoracic contralateral on T5, and the listing is in AI. The contact point will be the hypothenar, thenar, and the distal phalangeal joints of digits 2 to 5 of the inferior hand. The hand should be flat, and the segmental contact point is the posterior inferior aspect of the right and left TVP of the vertebral segment immediately below the vertebral listing, which is T6. And the stabilization hand would be the calcaneal aspect of the superior hand. Segmental stabilization point is the upper elbow, and the line of correction is A to P, I to S. So can you cross your arms for me? So I'm going to go on T6. Flex your head for me. Take a deep breath in.